Hey, stop what you're doing right now, because what I'm about to tell you completely contradicts what most men have been told their entire lives about this topic. I'm Dr. Anandi Gopal, a board-certified urologist with over 2 decades of clinical experience, and today we are going to talk about something that happens in my office almost every single week. Men come in, embarrassed, confused, sometimes even ashamed, asking me whether doing this every day is hurting them. And my answer almost always shocks them. What really happens when you ejaculate every day? Not what your gym buddy told you. Not what some forum on the internet claimed. What the actual science says. And I promise you, by the end of this video, you are going to look at this topic in a completely different way. Especially if you are over the age of 60. Now, a landmark study published in the European Urology Journal followed over 31,000 men across an 18-year period and found that men who ejaculated 21 or more times per month had a staggering 33% lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. 33%. That is not a small number. That is the kind of statistic that should be in every men's health pamphlet in every doctor's waiting room in the country. And yet, most men over 60 have never heard it. And before we dive into everything, I want to know who is watching this right now. Drop your age in the comments below and tell me. Has your doctor ever talked to you about this topic openly and honestly? I personally read every single comment on this channel, and I want to hear from you. Your experience matters, and honestly, your questions shape the content I create for you. Now, here is the thing I want you to stay for, because later in this video, I am going to tell you something about daily ejaculation and testosterone that almost no one is talking about. It is probably the most surprising finding on this entire list, and it has massive implications for men in their 60s, 70s, and even 80s. So do not go anywhere. Let's count it down. Number 5 to number 1, from the least discussed to the most powerful effect on your body. Starting at number 5, what daily ejaculation does to your prostate gland, and why skipping it may actually be doing you harm. Think of your prostate like a small factory that never fully shuts down. It is constantly producing fluid, secretions, cellular debris. And just like any factory, if the output never gets cleared, things start to back up. The medical term for this buildup is prostatic stasis, which simply means the fluids inside your prostate are becoming stagnant. And stagnant fluid is not just uncomfortable. It becomes a breeding ground for inflammation. And over time, inflammation in the prostate is one of the primary drivers of a condition called chronic prostatitis, prostate inflammation, which affects an estimated 35 to 50% of men at some point in their lifetime. Here is where it gets particularly important for men over 60. After the age of 60, the prostate has typically already begun to enlarge, a condition called benign prostatic hyperplasia, or BPH. Your prostate is essentially working in a more compressed, congested environment. Regular ejaculation acts like a flush cycle for that factory. It clears out accumulated secretions, reduces intraprostatic pressure, and according to research from the Harvard T.H. Chan School of Public Health, significantly lowers inflammatory markers within the prostate tissue itself. I had a patient, Gerald, 67, from Baton Rouge, Louisiana, who came in with chronic pelvic discomfort that had been bothering him for nearly 2 years. 2 urologists before me had recommended watchful waiting. When I took his full history, I learned that after his wife passed away 3 years prior, sexual activity had essentially stopped. We had a frank conversation about solo sexual health as part of his prostate care routine. Within 4 months of making this a consistent practice, his discomfort scores dropped by more than 60%. He told me it felt like a pressure valve had finally been released. That is not a coincidence. That is physiology. The practical takeaway here: consistency matters more than frequency spikes. It is far better to ejaculate regularly, even 3 to 4 times per week as a minimum, than to go weeks without and then overcompensate. And pair this with adequate hydration. Drinking at least 64 ounces of water daily supports prostatic fluid production and ensures that the flushing mechanism actually works the way it is supposed to. Number 4, the immune system connection, and why this may be the sleeper benefit nobody talks about. Most people think of the immune system as something entirely separate from sexual health. But your body does not work in isolated silos. Every physiological system is talking to every other system all the time. And the research coming out of places like Wilkes University in Pennsylvania suggests that regular sexual activity, including ejaculation, is directly tied to elevated immunoglobulin A levels. Immunoglobulin A, or IgA, is your body's first line of mucosal defense. It lines your respiratory tract, your gut, your urinary system. It is the bouncer at the door of your immune fortress. A study conducted at Wilkes University found that individuals who engaged in sexual activity 1 to 2 times per week showed immunoglobulin levels that were up to 30% higher than those who were sexually inactive. Now, here is why this is especially critical after the age of 65. Your immune system naturally begins to decline in a process called immunosenescence. Think of it as your immune system slowly retiring. The thymus gland, which trains your immune cells, has shrunk to a fraction of its original size by the time you hit 70. Your body is producing fewer naive T cells. Your inflammatory response becomes dysregulated. In this context, anything that meaningfully boosts your first-line immune defenses is worth paying serious attention to. The mechanism here is not fully understood, but researchers believe it involves the release of DHEA, dehydroepiandrosterone, a hormonal precursor that supports immune regulation and is known to decline sharply after age 50. Ejaculation appears to trigger a modest but consistent release of DHEA, which over time contributes to a more resilient immune environment. Pair this benefit with zinc-rich foods, oysters, pumpkin seeds, lean red meat, because zinc is essential for both immune function and reproductive health, and most men over 65 are mildly deficient in it without knowing. And speaking of pairing things, right now I want to pause for just a moment and ask you something. If you are finding this information valuable, information your own doctor probably has not sat down and shared with you, please take 2 seconds and hit that subscribe button and give this video a like. It genuinely helps this channel reach more men who need to hear this, and it tells the algorithm that this kind of honest, evidence-based men's health content matters. I appreciate every single one of you who does that. Now, let's keep going. Number 3, cardiovascular health and circulation, and the surprising reason your heart benefits from what happens below the belt. Here is an analogy I love to use with my patients. Think of your cardiovascular system like a network of garden hoses. The water pressure, the flexibility of the hose walls, the frequency of flow, all of these things determine whether the system stays healthy or starts to crack, clog, and fail. Ejaculation, as part of sexual activity or solo practice, is a genuine cardiovascular event. Your heart rate elevates. Your blood vessels dilate. Nitric oxide, the molecule responsible for blood vessel relaxation and healthy blood flow, gets released in meaningful quantities. Research published in the American Journal of Cardiology found that men who engaged in sexual activity twice per week or more had a significantly lower risk of cardiovascular events compared to men who were sexually inactive. The study adjusted for other variables, including physical activity levels, diet, and baseline cardiovascular health. The protective effect remained. Now, after the age of 70, nitric oxide production in the body has typically declined by somewhere between 50 and 75% compared to your peak levels in your 30s. This is one of the primary reasons erectile dysfunction becomes more common with age. The blood vessels simply are not getting the same chemical signals to relax and expand. Regular ejaculation, particularly when it involves the full arc of arousal, appears to provide a low-impact stimulus for nitric oxide production. Think of it like a gentle cardiovascular workout for your vascular system, not a replacement for walking or exercise, but a complementary signal that tells your blood vessels, stay responsive, stay flexible. I worked with a patient named Harold, 72, from Tucson, Arizona, who had been managing borderline hypertension for 4 years. After we incorporated sexual health into his overall wellness conversation, alongside dietary changes and a walking program, his blood pressure readings showed meaningful improvement over a 6-month follow-up. His cardiologist actually commented on it. Harold laughed and said he was not going to tell him why. To enhance this benefit, combine regular ejaculation with a diet rich in L-arginine, an amino acid found in nuts, seeds, and legumes that is a direct precursor to nitric oxide. Watermelon, believe it or not, is one of the richest natural sources of citrulline, which your body converts to L-arginine. Start thinking of your plate as part of your vascular health plan. All the scientific references for the studies I am mentioning today will be linked in the description below so you can read them for yourself. Number 2, mental health, mood regulation, and the neurochemical cascade that most men over 65 are completely missing out on. This one genuinely moves me because I have seen what loneliness and sexual disconnection do to men as they age. And the science here is profound. When ejaculation occurs, the brain releases a powerful cocktail of neurochemicals. Oxytocin, sometimes called the bonding hormone, surges. Dopamine, the molecule of motivation and reward, spikes. Serotonin levels increase, contributing to feelings of calm and contentment. And cortisol, the primary stress hormone that, when chronically elevated, damages everything from your heart to your gut to your immune system. Cortisol drops significantly in the aftermath. After the age of 65, men are at sharply elevated risk for depression. The statistics are sobering. The National Institute of Mental Health estimates that depression affects nearly 7 million Americans over the age of 65. And men are dramatically less likely to seek treatment or even recognize the symptoms in themselves. Testosterone levels are declining. Social networks are often shrinking. Purpose and identity can feel uncertain after retirement. Into this landscape, the consistent neurochemical reward of sexual activity is genuinely meaningful. A study from Princeton University found that sexual activity stimulates neurogenesis, the creation of new brain cells, in the hippocampus, which is the brain center for memory and emotional regulation. In aging brains, where neurogenesis naturally slows, this is a significant finding. It suggests that maintaining an active sexual life is not just emotionally satisfying. It may be literally keeping your brain younger at the cellular level. I think about my patient Robert, 74, from Portland, Oregon, a retired school teacher who came in for a routine visit and broke down in my office, quietly, not dramatically, and told me he had not felt like a man in years. He was widowed. He felt invisible. We talked for a long time that day. I encouraged him to reconnect with his own body on his own terms, without shame, without a partner being required for that to be valid and healthy. 6 months later, he described feeling more motivated, sleeping better, and, in his words, like someone turned the lights back on. The neurochemistry is real. Do not underestimate it. To amplify this benefit, pay attention to the mind-body connection during the experience itself. Mindfulness, even simple, deliberate breathing and presence, enhances the oxytocin and serotonin release. Rushing or approaching it as a mechanical task blunts the neurochemical benefit significantly. Your brain is paying attention to how present you are. And now, number 1, the benefit that most urologists are not sitting down and explaining to their male patients over 60. And it may be the most consequential finding of all: what daily ejaculation does to your testosterone levels, and the counterintuitive truth that the research reveals. Now, I know what many of you have heard, the old locker room wisdom: save it up, abstain to boost your testosterone. Athletes were told not to have sex before competition for decades. And if you look at very short-term data, within the first 24 to 48 hours of abstinence, there is a modest, temporary spike in testosterone. This is real. But here is where the story takes a dramatic turn, and where the long-term picture is almost completely opposite to what conventional wisdom suggests. A study conducted at Hangzhou Normal University in China monitored testosterone levels in men across a full 7-day abstinence period. On day 7 of abstinence, testosterone peaked, about 45% above baseline. But what happened after day 7? Levels dropped back to baseline, not permanently elevated, a temporary bump followed by normalization. Now contrast this with what happens in men who maintain regular ejaculatory activity as part of an overall sexually healthy lifestyle. Research consistently shows that these men maintain higher baseline testosterone levels over months and years, not because ejaculation directly creates testosterone, but because of the hormonal environment it supports. Here is the mechanism, and this is the part I want you to really hear. Testosterone in the aging male body is in a constant negotiation with a hormone called sex hormone-binding globulin, SHBG. Think of SHBG as a taxi that picks up your testosterone and takes it out of circulation, making it unavailable for your body to actually use. After the age of 60, SHBG levels tend to rise, which means more of your testosterone is getting locked up and rendered inactive even if your total testosterone numbers look acceptable on a lab panel. What matters is your free testosterone, the amount actually available at the cellular level. Regular sexual activity, including ejaculation, appears to support the luteinizing hormone signaling pathway. That is the hormonal conversation between your brain and your testes that says, keep producing. Men who are sexually inactive over long periods show measurable declines in this signaling pathway. The testes, in a very literal physiological sense, respond to the demand signal. Remove the demand, and production gradually downregulates. This is not folk wisdom. This is receptor-level endocrinology. I want to tell you about a patient named Thomas, 69, from Nashville, Tennessee. A former contractor, tough as nails, not someone who talked about this kind of thing easily. He came in with classic low testosterone symptoms: fatigue, brain fog, loss of motivation, a feeling he described as just going through the motions. His total testosterone was borderline, but his free testosterone was genuinely low. We talked about the full picture: sleep, resistance training, diet, stress management, and yes, sexual frequency as a component of hormonal health. We decided to hold off on hormone replacement therapy and focus on lifestyle optimization first. 8 months later, his free testosterone had improved by nearly 28%. He was sleeping better, had more energy, was back in his woodshop every weekend. He did not need the prescription. He needed the information. After the age of 70, your body loses roughly 1 to 2% of its testosterone production capacity every single year. That is not reversible. But the rate of decline and the bioavailability of what you do produce is significantly influenced by your lifestyle choices, including this one. The practical guidance here: daily ejaculation is not mandatory, and it is not necessarily superior to 5 or 6 times per week. What matters is regularity and the avoidance of long, repeated periods of total inactivity. If you go weeks or months without, the hormonal signal fades. Consistency is the medicine. And here is your synergy tip for this one. Combine regular sexual activity with resistance training at least 2 to 3 times per week. Even light resistance exercise, body weight squats, resistance bands, anything that loads your muscles, independently stimulates testosterone production and reduces SHBG levels. The two together create a compounding hormonal benefit that neither produces as powerfully alone. If you can only do one thing after watching this video, it is this combination. Now, I want to close with something that matters to me deeply as a physician, and as someone who has sat across from thousands of men in examination rooms over the years. Getting older does not mean stepping back from your vitality. It does not mean accepting a diminished version of yourself and calling it dignity. The men I have watched age with the most energy, the sharpest minds, and the most genuine happiness in their 70s and 80s are the men who refuse to let shame, silence, or outdated medical advice talk them out of caring for every dimension of their health. Sexual health is not separate from cardiovascular health, hormonal health, mental health, or immune health. It is woven into all of it, and you deserve a doctor who will have that conversation with you honestly. It is never too late. Your body is listening for the signal. Give it the signal. You have earned the right to feel well, not just to survive, but to genuinely thrive. for every year you have left. And based on everything the science is telling us, those years can be far more vibrant than anyone has told you to expect. If this video opened your eyes to something your doctor has never discussed with you, please subscribe to this channel right now, because this is exactly what we do here, every week. Honest, evidence-based, no-shame conversations about men's health for men who are not done yet. And I want to leave you with one final question for the comments. Has your doctor ever talked to you openly about sexual health as part of your overall wellness plan? Yes or no? I want to know. Drop your answer and your age below. I read every single one, and your answers genuinely guide what I cover next. I will see you in the next video.